Hello everyone. In this video I'll be explaining the the overview of stenting. Okay, so vascular stenting is just a method to combat or is a surgical treatment for the coronary artery disease and the stroke. Okay, so these are the two conditions. Stroke is related to the brain disorder and coronary artery related to the disorder of the heart. Okay, so in that the blood vessels are blocked, and for that we use stent as a surgical treatment. So in this case, as both our disease are caused by the blockage of the lumen of blood vessels, as I told you. Now the cause is the deposition of plaques. We can say plaques is just like a fatty material. The persons who are on the high level of cholesterol, they usually in this is actually the etiology for those patients. The deposition of fat in this condition is called as atherosclerosis, and this leads to the narrowing of the lumen of the blood vessels, and for that we use the stent. Okay, the cardiac stenting is a minimum invasive operation which destroys the atherosclerotic plaques, as I told you. And what is stent? Stent is just like a microtube. Okay, like a cylinder shape, which is just inserted by a catheter. Okay, inside the lumen of the blood vessels, and now where the area of the blood vessels is narrowed due to the plaque deposition, that is widened by this stent. Okay, now what are the types of surgery where we use actually not only the heart vessels, that is in the coronary artery we use, but also we use in the carotid artery. So this is related to the pathology of stroke. Okay, when there is blockage in the carotid artery, the artery which is supplying the blood to the brain, in that if there is any deposition of plaque, there we can also use. Okay, and some vessels in the lower extremities also. So we actually stent coronary artery so that the heart function normally and supply to heart muscle is not stopped. So the main motive or the main indication to use stent is to make the blood supply to function normally. Okay, so in this image you can see what is stent. Okay, how it looks. You can see this is the steel material, and this you can see this is a blood vessel, the cut part, and in that the stent is deposited. In this diagram you can see this is the overview of this blood vessel. These are RBCs, and you can see the stent is placed here. Okay, so stent is placed where there is narrowing in the blood vessel. Okay, and this condition is called as angioplasty stent. Okay, now let's move on to the indications. As I have told you, it is stroke and the heart muscle. Clear? Now stroke is a hemorrhage due to the blocked vessel. Clear? There are two types of stroke, ischemic and hemorrhagic. Okay, so it is detailed. Now necrosis of the heart muscle due to the atherosclerotic plaque. So in the case of heart attack, there is the necrosis, you can say, or death of the cells of the heart muscles, because they are not receiving the oxygen or the blood, the nutrition to that heart muscles, and due to that there is necrosis, the death of those cells of the heart muscle, and which is due to the cause is atherosclerotic plaque. Okay, the fatty deposition which I told you. Clear? Now you can see in this diagram, the same diagram, I have the photo also. You can see this is actually your heart attack. When heart attack is, there is the cut part, and you can see this is the blood vessel, coronary artery, and there is blockage. You can see this yellow part here. This yellow part is actually your atherosclerotic plaque inside the blood vessel. Okay, the artery. Clear? Now area of the cardiac arrest is heart attack. Okay, and like stroke, you can see this is a carotid artery, and there is again the deposition of plaque here, and there is hemorrhage in the brain due to the blocked vessel. So this can occur in the brain and the heart both. Now findings. We can see the angiography to check the procedure. Diagnostic method, we have the angiography to check there is any stenosis, okay, the narrowing or dilation aneurysm inside the blood vessel. So if stenosis be present, we used to do or prevent by placing the stent to prevent re-stenosis. Okay, so this much is clear. Now what can be the contraindication related to stenting? So patient who cannot take antithrombolytic therapy, that is the like aspirin or clopidogrel, so this medicine who patient can't take, we can't do this stenting for them. And patients who have hypertension, stroke or bleeding type conditions, we can't also do stenting in these patients. Pulmonary edema, history of anaphylaxis, okay, the allergic condition, and difficulty between the patient and doctor contact. Clear? So these are the conditions in which we can't do stenting in the patient. Now how the stenting is done, the stages for stenting. You can see the first the patient is prepared, that is all the history of the patient is taken. If there is any type of past diseases like history of contraindication, this contraindication if patient is having, we can't process stenting in those patients. So we use actually angiography, we take the patient's ultrasound, ECG, X-ray of chest, okay, and the history of contraindications if there is any. Now coronary stenting, how it is done. So first the area where we have to do The stenting we use actually apply local anesthesia there. Now we add X-ray contrast substance inside the blood, in that blood vessel. Okay, actually we invase, just incision is done in the skin, like you consider femoral artery, there incision is done, small incision, and from there a catheter is inserted, and catheter is reached where there is formation of plaque. Okay, in the region where in that blood vessel where there is formation of plaque, in that the catheter is reached, and again the second catheter with the stent is again processed toward that area. Okay, and this is done by fluoroscopic angiography. Clear? And after reaching the desired location, the surgeon inflates. Now the surgeon inflates that catheter, okay, balloon inside the blood vessel, and now the stent from the second catheter is placed there. Okay, and this process actually take up to 2 hours. Clear? Now rehabilitation, this is the recovery of the patient, how much time the patient takes to recover after this surgery. So it can live healthy after 2 or 3 days, the patient can leave the hospital. Okay, but it takes around 1 month. Clear? Now you can see in this X-ray, okay, you can see this is the normal condition, this is a normal patient, the blood vessels, but you can see here there is stenosis, here you can see. So this is actually the narrowing of the blood vessels, and this condition is called as stenosis. So for stenosis we use the treatment of stent in this vessel to widen this vessel. Okay, here you can also see. So this is the main diagnostic procedure you can see in this angiography. Clear? Now the complication of stenting. After the surgery has done, stenting is done, what can be the other complication? Like arrhythmia patient can have allergies to the contrast agent we use to check the region or catheter, the allergy to those contrast substances. There can be infections, and there can be dilation in the blood vessel also. Okay, that is called as aneurysm, and the thrombus formation. There can be clotting in that area, like in the coronary artery or carotid artery. So this was actually the stenting. I think it is clear. So thank you.